year's largest gathering of cancer doctors kicked off this weekend in Chicago, where the biggest buzz is around treatments for skin and ovarian cancer. Bloomberg's healthcare reporter Shannon Pettypiece joins us now from the conference for more on these latest developments. Shannon?
Thank you, Betty. I'm here with the ASCO president. He's running this whole meeting this year, and he's also one of the top breast cancer doctors out there. So is it Dr. George Sledge is here with me. And so, Dr. Sledge, tell me, what are some of the one or two things that got you most excited this year in the world of cancer research?
Well, clearly this was the year of melanoma. We had two breakthroughs with melanoma this year. We had a drug that stimulates the immune system to attack melanoma cells. We had another drug that interferes with a critical growth pathway in melanoma. Both of these drugs appear to improve survival for patients with advanced melanoma. One's already been approved by the FDA a couple months ago. One is likely to be approved later this year.
And why do you think we're seeing so many breakthroughs in melanoma right now, all of a sudden this year?
Well, we're seeing the payoff of a generation's worth of research. And in particular, our ability to probe the molecular biology of the cancers to understand what makes the cancer tick at a very basic genetic level.
Well, that seems to be a big theme here, is understanding that it's not just breast cancer, right? It's breast cancer with a certain genetic mutation. That's something
right.
We're going to see more of?
What we're finding is that many of these critical pathways may exist across several different cancer types. So we're thinking increasingly in terms of targeting pathways rather than targeting organs of disease.
Well, you know, as we talk about all these new treatments here, I worry about cost. Each one's going to come with a cost. The Bristol Myers drug you mentioned, $120,000 per patient.
Yeah.
As a doctor, how do you feel about that? Are we going to be able to pay for all these?
Well, I worry about it at two levels. As a doctor in the clinic, I have to explain this to my patients, and of course not all of my patients are equally well insured. So we may reach the point where we're not able to cure patients at the rate that we're going. As a citizen of the United States, of course, I worry about these break-the-bank drugs for their ability to pull down the entire healthcare system. It's a real issue for us.
And as cancer doctors, as a cancer community, is there anything you feel you can do about it?
Well, the best thing we can do from a scientific standpoint, and this is why this new era of targeted therapy is so important, is to give our drugs in a very precise, targeted fashion. Being able to actually measure the mutation that we're targeting in a particular cancer. So for instance, one of the melanoma drugs that I mentioned works in about 45% of patients with melanoma. We know exactly who those patients are, so we don't treat everyone with melanoma, just the ones who have that particular mutation.
And I want to ask you real briefly, there's a drug for breast cancer there you specialize in called Avastin. The FDA wants to revoke the approval for that drug because it doesn't help patients live longer. Do you think that's the right move? Should the FDA revoke approval of this drug?
Well, the issue with this particular drug is that it improves the length of time patients remain progression-free for advanced disease, but in 3 different studies it does not improve overall survival. I think it's reasonable for a society to ask whether or not we approve drugs that don't improve overall survival. Now, I'll tell you, amongst my colleagues, there's considerable disagreement on this. Many physicians feel that something that prevents your cancer from growing for 6 months is a good thing for patients. Others feel that the cost of this drug is just too much not to improve survival.
And as you as a doctor, would you prescribe this drug to patients if it's still on the market?
I certainly have prescribed it, yes.
And do you feel there is a benefit there?
Well, I certainly think there's a benefit to someone's cancer not growing for 6 months, yes.
All right. Thank you, Dr. George Sledge. Thank you so much for joining us.